Well, good afternoon again. One of the things that I have learned about doing this job is to be flexible, and so we are flexible, and I appreciate your all's patience. A little glitch in our technology, but we will persevere. So thank you all again for joining us, and thanks for your patience. Today I want to talk about elections and our next steps as we plan and prepare to ease the restrictions at the appropriate time and get our economy back up and running safely. First, on Wednesday, the General Assembly returned to Richmond for their reconvened session. It was the final day of the most progressive session in history, and I thank all of them for their hard work. Many of their actions on Wednesday were positive, and I'm grateful for all of the actions they supported to give us more tools to address the effects of the pandemic on hardworking Virginians. We now have protections for homeowners and renters who have lost income due to COVID-19 from eviction and foreclosure. We'll establish a COVID-19 relief fund to help small businesses impacted by this public health crisis. We created a work share program as an important tool to help workers keep their jobs. Nursing homes and long-term care facilities will receive critical funding in the wake of unprecedented challenges. And we will finally increase the minimum wage in our Commonwealth. But they didn't get everything right. One thing they did not do was to act to move the May 5th local elections. Elections are vital to democracy, and so it is the right to vote. Virginians should not have to choose between their ballot and their health. The last thing that we want in Virginia is a scene like what we saw when Wisconsin held an election a few weeks ago. People waiting in line for hours, trying to social distance just in order to vote. That's why I recommended moving the May elections to November. I'm grateful to the House of Delegates for supporting that. I am greatly disappointed in the Senate for failing to take this action to protect our fellow Virginians. Today, I have signed an executive order moving the May elections back 2 weeks to May the 19th. That is what the Constitution empowers the governor to do absent General Assembly action. If you plan to vote in that election, I strongly encourage you to vote absentee by mail. And I'll repeat that. I strongly encourage you to vote absentee by mail. For people who do come out, we will make it as safe as possible. We are planning to use some of the volunteers through our Medical Reserve Corps to help election workers and polling places put additional safety measures in place. That will include an adequate supply and proper use of PPE for our poll workers. Now, let's move to our jobs numbers. Last week, more than 82,000 people applied for unemployment benefits in Virginia. That means almost 500,000 Virginians are now unemployed. While this is a large number, the good news is that Virginia has the 10th lowest claims per labor force in our country. On Saturday, we launched the Pandemic Unemployment Assistance Program, which allows independent contractors and gig workers to receive benefits. More than 50,000 Virginians have successfully filed under that program, and they should see benefits by the end of next week. While I understand many people have been frustrated by website difficulties and wait times, Virginia has been one of the most innovative states in ramping up our ability to respond to the sudden large increase in people filing for unemployment. We worked with Microsoft and Virginia Interactive to launch a portal with mobile and texting capabilities, and VEC has been a national leader in working to help Virginians receive these benefits as quickly as possible. Many have already begun receiving their checks. As I said, having 500,000 people unemployed is very unfortunate. And so I want to talk about how we're planning to move Virginia forward. I know everyone is eager to move forward. I know that I am. Yesterday, I extended the ban on elective surgeries through May the 1st and the closure of DMV offices through May the 11th. I took these steps because while we are working toward a time when we can ease some of these restrictions, we are not there yet. But we are moving in that direction. So today I want to outline how we will determine when we can ease restrictions and our blueprint for what that will look like. We have some slides. With our glitch in the technology, I'm not sure if all of you will be able to see those slides, and especially for the hearing impaired, we will have the words that describe these slides in full detail for you after our presentation. First, I want to talk about where we are today, and then we'll talk about where we're going tomorrow. Since the beginning of this situation, we have taken aggressive action. We closed schools, restricted businesses, and directed people to stay at home. We know that this work and the sacrifices of Virginians are delivering results. Together, we have slowed the spread of this virus. Our hospitals have not been overwhelmed, and according to at least one model, we may have seen our case count peak today. I hope that is true, but we must continue to work to keep counts low. We continue to watch the data. Our daily case numbers are still rising, as you can see from this chart, looking at the blue line on the top. But our growth rate is slowing. We see that our case count was initially doubling every 3 days, but now it is taking 9 days to double. That means the growth rate is slower. And hospitalizations rates remain flat. The yellow line at the top is total beds available. The orange line shows that those hospitalized with COVID-19 remains flat. The good news is that 1,600 patients with COVID-19 in Virginia have been treated successfully and discharged. And our PPE pipeline is flowing. We also have ordered 3 large decontamination systems to deploy across the Commonwealth as needed that can clean masks. We'll keep working to buy PPE and to help businesses figure out how to manufacture it. So we need to keep doing what we're doing, and we need to plan for that next phase. Our metrics for phase 1 are very clear. We need to see the percentage of positive tests and the number of hospitalizations both track downward over 14 days. We need to be sure we have enough capacity in our hospital beds and in our intensive care units. And we need to sustain our PPE supply. We will get back to work by greatly increasing our testing, then tracing the contacts of people who test positive and isolating these individuals, not everyone in Virginia. That is the key to moving forward. I'm going to step aside for just a moment and let Dr. Karen Remley explain how we're going to ramp up testing. Dr. Remley is helping lead our testing task force. Dr. Remley, welcome.
So as we work, I think the most important thing to say first, testing is driven by, in terms of the strategy, the governor and public health leaders behind me decide where we're going to test and how we're going to test. What this is looking at the different steps we need to take. We've moved from step 1 into step 2. Many of you who follow the numbers know that we've done 4,000 tests a day in the last 2 days. And what we're really doing is moving from just testing that priority 1 group, which were healthcare workers and hospitalized people, to expanding to people who are high risk and that includes people with chronic disease, pregnant women, babies born to mother with COVID, and the uninsured and underinsured. As we do that, we're looking for ways to expand, and a lot of that is working with our clinical communities to make sure they feel comfortable and know how to do the test, and make sure we're testing across the state. And as you can see, as we move to the third group, we continue to look at innovative ways to get testing to different communities, to be able to do large-scale testing, and support all of the work of the health department as they do what Governor Northam just described, boxing people in, making sure we understand where that disease is and how we take care of it. And as you can see, these are rough estimates on how we can make this happen. In Group 4, we're really at that point where we're able to do large-scale testing across the state, and that'll include looking at people who are asymptomatic to determine how much disease we really have throughout the Commonwealth. And then we all can't wait until we get to step 5, which is where we have just kind of an ongoing, very small amount of disease that we can pretty quickly be able to identify and to be able to isolate. With that, I'll turn it back over to you, Governor.
Thank you, I appreciate it. So moving forward, we will maintain this testing and tracing strategy. We will ensure that hospitals, providers, medical volunteers, and frontline workers have the PPE they need to stay safe. And we'll monitor our hospital capacity and use of ventilators, ICU beds, and medical staffing. When we see these metrics I've just outlined, fewer positive cases, more testing and tracing, more PPE, and steady use of hospital beds, then we can move to phase 1 of easing these restrictions. Phase 1 will still have heightened restrictions in place. Social distancing, for example, will continue. Teleworking will be encouraged and will also continue. We will still recommend face coverings in the public. For business to resume, both customers and employees must feel safe. To create our Forward Virginia Blueprint for Phase 1, we have been meeting with stakeholders, local governments, and business leaders. We have put together a small work group of representatives from businesses large and small in every corner of our state. It includes barbershops, theaters, hotels, and campgrounds. We're talking to manufacturers like Volvo trucks, restaurants like Mama J's right here in Richmond, and entertainment venues like King's Dominion and the Barter Theater. Faith leaders will also be part of our work group. We want them to tell us what is the right way to ease restrictions. What will that look like on the ground? What is practical in real life and what is not? We will use their input as well as input from dozens of Zoom meetings we've had with local government officials, business associations, hospitals, and health associations, and other groups to develop 2 sets of guidance. We'll have overarching rules for our businesses, as well as industry-specific guidance for sectors like restaurants and non-essential retail. This will help make sure that everyone knows the rules of how they must operate when it is safe to do so. As we go forward, we will fill in the details of the Phase 1 blueprint and develop plans for Phases 2 and 3. I am as eager as anyone to move into the time where we can ease some of these restrictions. But we must do so in a safe manner, one that seeks to avoid causing a spike in cases or a surge our hospitals cannot handle. As I've said before, we cannot and will not lift restrictions the way you turn on a light switch. We will do it responsibly and deliberately, and it has to be grounded in data. We will move forward, but in a way that prioritizes public health and creates public confidence. Easing too much too soon could jeopardize public health and consumer confidence. 1 step forward and 2 steps back is no way to move ahead. We will need everyone to continue taking actions to keep themselves and others safe. When you cover your face in public or stay 6 feet away from others, you aren't just protecting yourself. You're protecting other people, and that is the most important part of these efforts. None of us is in this alone. All of our decisions impact other people, other Virginians. I continue to be grateful to our medical professionals, our frontline workers from hospitals to grocery stores, and everyone in Virginia who is staying home and making sacrifices to help us get through this together. As you have heard me say many times, we are in the middle of a health crisis as well as an economic crisis. And as soon as we together can get this health crisis under control, as soon as we can put this health crisis behind us, we will be able to get our economy up and running again. So I thank all of you for your cooperation. Now we'll hear from Virginia Health Commissioner Dr. Norm Oliver, and then we will be glad to take questions. Dr. Oliver, welcome.
Thank you, Governor. Good afternoon. Just an update on the cases that we have of COVID-19 in the Commonwealth. As of the last reporting period, we now have 11,594 cases. That represents 596 new cases in the last reporting period. We have a total number of deaths of 410. That's an increase of 38. I have been giving periodically some numbers on the breakdown for race in these cases, and I have to apologize for the fact that I hadn't been breaking it down by ethnicity. We'll start doing that in the coming weeks, beginning on Monday, and then we will also include that race and ethnicity breakdown on our web site. Overall, the numbers still are tracking about the same, with African American cases numbering about 28%, deaths around 25, also around 28%, and among the Latinx population, the deaths are numbering at 5%, and the cases are numbering at 26%. Thank you.
Thanks, Dr. Oliver. Be glad to take your questions.
Yes. Hi, Governor. Do you have any idea of when you think you might be able to get to that benchmark of 10,000 tests per day in order to reopen the economy in the state?
Well, I think as Dr. Remley explained, you know, the answer to your question, we don't have an exact date, but 10,000 is certainly our goal. We're doing this in a stepwise fashion as fast as we can. But to, you know, just to kind of go back in history, 6 weeks ago, we had our first case in Virginia. It was on March the 7th. And at that time, the testing that we were doing in Virginia was sent to Atlanta, to CDC. And so that process has evolved to include our state lab here in Virginia. VCU, UVA have developed testing, private labs to include LabCorp and Quest, and then finally the hospitals, the healthcare systems themselves. And so we've gone from just a few test capability to now where we're testing 2,000 to 3,000. Today we've tested over 4,000. Again, that's taken 6 weeks to get to where we are today. I don't expect it to take another 6 weeks. Really wonderful work is going on. Dr. Remley has been organized this, kind of collaborating. And one of the, I guess, one of the challenges that we've had, one was supplies, obviously, and we're doing better with our supplies. But the other challenge, quite frankly, was that the test was so cumbersome that a lot of providers in Virginia were just choosing not to do it. So we wrote a letter to our providers and have encouraged, and rather than the last mile, it's really the first mile, getting the patient, having the testing availability there, and getting our providers to do that testing. So I would hope, again, that this will be ramped up in the next couple of weeks, but as far as an exact date of 10,000, I don't have that, but as soon as we can get there, we will.
Governor, Dr. Remley. When you say that the tests were too cumbersome, that doctors weren't doing that, what exactly does that mean? And has the state pinpointed any other reasons why testing isn't at the level that we'd like?
Yeah, Kate, when I say cumbersome, one, not having the supplies in your office. Doctors, obviously, just like everybody, they're very busy. So in order to get a test kit in their office was difficult. That's become a lot easier, a lot more efficient now. The other, when I say cumbersome, the other drawback was, as you remember when we were talking about this earlier, some of the results were taking 5, 7, 9 days in order to get those results back. And so, again, it's kind of like, well, if I don't know if I'm going to even get the test results back for 9 days, why do the test? And so now it's become much more efficient. The turnaround time is much shorter. And I think what you'll see as we have collaborated with the labs, with the supply chains, with the providers, the testing will get up and running in a much more efficient manner.
And what's the capability at the state lab currently? Is the plan to build capacity through relying on more private labs or through boosting capacity at the state lab?
Kate, I don't have the exact answer, but I have someone that may be able to help us out. So, Dr. Tony, thank you.
So the question was, what is the capacity at the state lab? And we have definitely increased our testing capacity, and we are now able to test in the range of 400 to 500 tests a day. But we are also working in collaboration with hospital laboratories, both UVA, VCU, and Virginia Tech, and trying to coordinate our efforts to expand testing across the Commonwealth so that, as Dr. Remley mentioned, we can meet that benchmark of 10,000 tests across the Commonwealth. But that will also include some of the private commercial laboratories as well.
And Dr. Remley is going to expand on some of the comments I made as well. Dr. Remley.
So I think what's really important is the clinical community has done exactly what they've been asked to do. They're continuing to see patients by telemedicine. They're trying to decrease the amount of patients who come into their office. But the other thing to remember is the gold standard first test was something we call a nasopharyngeal swab. And you probably have heard people talk about it. It's a skinny little swab that goes all the way back in your nose. If you're a pediatric ER doctor like me or a pediatrician, you do them every winter when kids are sick for RSV, respiratory syncytial virus. If you're a cardiologist, you may have never done that before. So we are involved in a very collaborative but very aggressive turn time to really make sure all of our clinicians understand how to do this safely, how to do it accurately, and to be able to use the private labs that are out there to get these tests done out in the community.
Hi, my question is for Governor Northam. So you've talked about coordinating with Maryland and DC about when to allow for non-essential businesses to reopen. Since much of Virginia is not experiencing the same infection rates as Northern Virginia, would you consider lifting restrictions earlier in other regions of the state? And what factors would play into making that decision?
The question is that obviously some parts of our Commonwealth are more dense than others. They've had larger numbers of positive tests, larger numbers of hospitalizations. But we've seen spotty cases throughout Virginia. And so the question was, do we plan on opening up some parts of Virginia before others? And I have really, as best I can, tried to be consistent. And doing this as the name of our Virginia is a Commonwealth. So our plans to date, as of today, are to not open up one region before the other. What we'd really like to see, I've given the guidelines of when we plan to ease these restrictions. We are hopeful that we have hit our peak. As you know, businesses have been asked to close through May the 8th, which is 2 weeks, by the way, from today. Hospitals will be allowed to do elective surgeries a week from today, which is May the 1st. If our numbers will continue, if we can get a little bit of help out there with our numbers, I would really like to see us be able to go into phase one as soon as May the 8th, but certainly no sooner than that.
Another one on the phone, and then we'll come back. The next question will be from Roberta Roldan with UPM.
Yes, thank you. Governor Northam, candidates running in municipal elections in November are currently being forced to either go out and get voter signatures during the stay-at-home order to meet that May 9th deadline, June 9th deadline, excuse me. Other states have extended filing deadlines or moved to allowing electronic signatures, and I just want to know if your administration has any plans to address the issue of qualifying for the ballot during the stay-at-home order.
So, good question. I'm going to let our Secretary of Administration, Secretary Connors, answer that. Thanks, Kiana.
Yes, thank you for the question. We are aware that candidates who are running for the November ballot as an independent have a June 9th deadline to turn in all of their petitions as well as their declaration of candidacy. We are exploring a number of options. Unfortunately, we do not have the technology today to allow for electronic petition signatures. We are hoping that as some restrictions are lifted, that candidates will be able to meet that deadline. I will also say that some candidates have sought relief from the courts to lower the number of petitions that they have to submit, and that is also always an option for candidates to pursue.
GOP sent out a letter today asking for you to reconsider your decision, particularly surrounding some of these non-essential businesses, as we're calling them. Obviously, we're seeing some states move forward without the data matching as far as this 14-day decline. So can you speak a little bit more to that decision and why you're so adamant about those numbers matching up before you progress forward?
So I believe the question was that some individuals in Virginia have sent a letter, is that?
Yeah, the GOP.
Or put out a statement that we should look at easing the restrictions outside of the guidelines that we have presented? Is that?
Surrounding non-essential businesses.
Yeah. Well, the first thing I would say is that the guidelines that we're using come from the CDC, and they were announced by our president a week ago yesterday. And so while there have been some mixed messages coming out of Washington, that is a message that I think the governors across our country have tried to abide by. Obviously, nothing is written in stone, but we have really been trying to make our decisions with data and following the science. And the CDC, I think, is a good source of guidelines, and so the guidelines that I have outlined today that we've been talking about every day, for that matter, come from the CDC, and we'll continue to follow those.
Next question is from Bill Atkinson with the Progress Index.
Thank you very much. Governor, prior to the suspension of the utility cutoffs, there were many people, especially in our area and in the lower income communities, who had previously had their water services shut down prior to the suspension, and they were working on trying to get them reinstated when everything happened. And they are finding themselves really like without water and some of the other utilities. And without the water, they're unable to follow some of the CDC protocols, such things as washing their hands. Is there anything the state can do to work with some of the more local utilities like water and sewer to make sure that these people who are working to try to get the access turned back on will have that access during the crisis?
If I heard the question correctly, that it sounded like some folks have had their utilities, their water turned off, and I regret that being the case. I don't have any reason to doubt what you're saying. But I would say that if there are families out there that are having those difficulties, please direct them to our website, and we will do everything that we can not only to help the families, but also to deal or discuss this with the utilities and forgive them for not being able to pay their bills during this difficult time. So please refer those to our office, and we'll do everything that we can to remedy the situation.
What are businesses saying about Phase 1 guidelines, and if they're going to be able to actually meet those guidelines when we do get back to reopening?
Yeah, it's a great question. Angela, do you want to talk? Angela Navarre has been communicating with our businesses on a daily basis. Thank you. Welcome.
So Angela Navarro, Deputy Secretary of Commerce and Trade. Your question is, what has the business response been relative to guideline development? So we're working with businesses both through the business task force that the governor announced earlier today, as well as with business community members outside of that task force. We're really seeking their guidance and their recommendations as we're developing these guidelines. We're of course working with the Virginia Department of Health, and all of the guidelines are really focused on ensuring public health and security of individuals as they enter the workforce and as they go into these public-facing businesses. We've had a really strong and positive response from businesses. They want consistency and they want clarity from government as we're putting out these guidelines, and that's what we're hoping to provide in developing this process, is that consistency and that clarity. Thank you.
And Henry, just to follow up on that, as I've mentioned earlier in my comments, this recovery, this economic recovery, is really going to be driven by our businesses and by our consumers. And so this is the reason we've reached out to businesses, because they have to be in a position, whether it be a barber shop or a hospital, to make sure that consumers are comfortable coming back into their place of business. And so they've really, I think, been creative and innovative and certainly part of the solution. And we've really been pleased by the response so far.
The next question will be from Mike Morello with WTOP.
Governor, thank you so much for taking my question. I know you touched on this a bit, but with many Virginians frequent commuters into D.C. and Maryland, how might the decision to ease restrictions in the Northern Virginia region be impacted by what's happening in Maryland and D.C.? Could a lot of case activity, say in Maryland or in D.C., potentially delay any easing of restrictions in the Northern Virginia area?
The question, I think, deals with consistency as we move forward with easing these restrictions. And I'm in frequent communication with the mayor of Washington and the governor of Maryland. We're neighbors, especially in the Northern Virginia area, just separated literally by the Potomac River. And while it's not going to be an exact easing of guidelines, we are doing everything that we can to work together to be as consistent so that we will decrease any confusion moving forward. So again, every state, every city has a little bit of a different situation, and that's certainly the case between Maryland, Virginia, and Washington. But as best we can, we're going to try to be consistent as we move forward.
Can you talk more about contact tracing and what the state's goals are for that? I know it's pretty labor-intensive effort. I also know that Dr. Carey has talked about the use of maybe phone apps or something like that to track people and their risk. Can you expand on what the state is planning for tracing?
Yeah, I think Dr. Oliver first.
The question was to please expand upon contact tracing and how we propose to do that as we step up to prepare for phase one and going into phase one of recovery. As you pointed out, contact tracing is a very labor-intensive thing. For every one person who has COVID-19, you have to track down all the people that they've come into contact with. We understand that as we begin to move toward decreasing social distancing, we will have to increase our ability to do contact tracing because the cases will start to rise again, and we want to try to contain that as best we can. So part of what we're doing is not only ramping up on our testing capabilities, but looking to ramp up our medical workforce, utilizing our medical reserve corps, utilizing furloughed and underutilized healthcare workers through hospital systems and private practices, and other volunteers as well. We also are looking at a number of apps to help us in that process. I would point out that even with those apps, however, we will still need that expanded workforce. There will be other work that will require human intervention, and we won't be able to just do it all electronically.
Are there any specific applications or companies that are doing this work that you're looking at that you can tell us about today?
The question is, are there any specific applications? We're looking at a number. There's none that we've particularly latched onto at this point, but there are several interesting possibilities, and many of you probably already know about Google and Apple working on something that supposedly will be ready sometime in May.
I'll simply add to Dr. Oliver's answer is that we are, even this afternoon, after this is a briefing with Apple to see what progress they've made and where that application may be able to fit into the plans that Dr. Oliver, Dr. Filano, Dr. Peak can use as they expand that capability. That is human, but also with tools. So that is obviously an emerging field, and we're looking broadly to see what are the right tools for Virginia.
Yes, thank you, Governor. You emphasized absentee voting in your remarks on the election. I just wonder if your order is going to extend the deadline for absentee voting since you're extending the election.
Yes, so the question is, will the deadline for absentee voting be extended due to the governor postponing the election? And the answer is yes. So the last day to request an absentee ballot is May 12, and then the last day to return an absentee ballot is 7 p.m. on Election Day, May 19.
Maybe you want to address that? Laura, I was going to give it a try, but I'm going to I'm going to let Dr. Filano, I'm going to take off my doctor's hat and let a real doctor address it.
Hi, thanks for the question. The question is it expected that we're seeing case counts continue to rise right now? Is that right? Yeah, so I think that is expected, particularly as we increase testing capacity. You obviously will detect more cases, and those cases will be counted. I think some of the phased recommendations you saw today point to positivity, so what proportion of tests are positive. So that's another important measure to look at. Thanks.
Well, just in closing, a couple comments I wanted to offer, and I appreciate your all's patience. The work that is being done right now to obtain more PPE, to do everything that we can with the guidelines to flatten the curve, to increase our ability to do more testing across the Commonwealth of Virginia is really done now in an attempt to be able to open up our economy and get back to where we were prior to this. And as I answered a little bit earlier to one of the questions, this recovery is going to be business and consumer driven. And perhaps it's not a good analogy or comparison, but we all remember what happened back in 9/11. And after that time, Americans were fearful of getting on an airplane and flying, understandably so. And so a lot of modifications were made, and in time, people again became comfortable, and we got back to as near normal as we could. And that's really what we're doing now with all of our efforts. We want to make sure that our businesses are doing everything that they can, and that's why we established this work group to let our consumers, whether it's a barbershop or a hardware store or the hospital, we want to make sure that the consumers feel safe and comfortable that when they come into that place of business, they're safe. And so there's a lot of effort that's going into really working on how we can make that recovery as efficient and as effective as we can. I wanted to take this opportunity, I know we're all going into the weekend, but I wanted to again thank some people. Because a thank you goes a long way, and to the press, to all the journalists, all the networks that faithfully come to all of our press conferences and write about this on a daily basis or broadcast and really work to make sure that Virginians are getting accurate and updated information. I say thanks to all of you. To those individuals that are working in our hospitals, in our nursing homes, in our grocery stores, our first responders, our law enforcement agents that literally are working around the clock to keep Virginians safe. On behalf of Virginia, I sincerely say thank you for all of your dedication and work. And then finally, you have heard and seen some very talented people that stand with me every day, and there are a lot that work behind the scenes. And I just want to let you know how hard they're working. 7 days a week, a lot of them are working through the night to make sure that we as Virginians can recover from this. And so on behalf of the Commonwealth of Virginia, to all of them, I say thank you. They are what make me proud as a Virginian, and hopefully you proud as well. So as I said, a thank you goes a long way. So if you see a first responder or someone who's working in the hospital or one of our cabinet secretaries or staffers, just please tell them thank you. And to all of you, it's Friday. That's a good thing. I hope you all get some rest this weekend. Have a safe and peaceful weekend, and we look forward to being back with you on Monday. Thank you all so much.